Hi, my name is Tracy. Today, I'll be presenting breast, prostate, and colon cancer screening with my friend Jackie and Luke from the UConn School of Pharmacy, preceptor by Dr. Lisa Holy. So what is colon cancer? Colon cancer is a cancer of the colon or rectum located at the digestive tract of lower end. Colon cancer in the U.S. According to the data in 2018, in the U.S., there's 141,074 new cases of colon cancer and rectum cancer were reported, and 52,163 people die of this cancer. So for every 100,000 people, 37 new colon and rectum cancer cases were reported, and 13 people die of this cancer. Colon cancer can develop from colorectal polyps. There are two types of polyps. The first one is hyperplastic polyps. It's an increased number of cells in an organ or tissue. There's a very small chance that hyperplastic will progress into colon cancer. However, for adenomatous, it's a benign, non-cancerous growth, but may be a precursor lesion for colorectal cancer. Polyps greater than 1 centimeter in diameter are associated with a greater risk of cancer. So 9 out of 10 colorectal cancer began as an adenomous, which is the second type of polyps. There's some uncontrollable risk factors: age over 45 to 50 years old with existing polyps, inflammatory bowel disease, diabetes, or inheritable risk factors, basically family history of colon cancer. However, there are some lifestyle risk factors which is changeable, like physical inactivity, obesity, alcohol consumption. So moderate to heavy drinking will increase the risk. Light drinking, like less than 1 drink a day, won't contribute to cancer. Smoking. So smoking is very terrifying because even after smoking cessation, so if you stop smoking, there's still an increasing chance of different form of cancer. The last one is the Western diet. So here are some reduced factors for colon cancer. However, before I go in deep on this slides, there's some emphasis I want to make is that all of this bullet point itself has not been proven beneficial in colon cancer prevention, other than colon cancer screening, which is the golden standard. And all of them come with significant side effect if missed. So overall, this slide is just want to show you that these factors can be beneficial when you're considering your risk of colon cancer before screening. So aspirin and NSAIDs use. Regular aspirin or NSAIDs associated with a 20% to 45% reduce in colorectal cancers. The benefit and risk reduction, however, required at least 5 to 10 years of the use. However, aspirin can also cause GI bleeding, GI mucosal damage, GI ulcer, and lead to another form of cancer called gastric cancer. The second one is postmenopause hormone use, also called hormone replacement therapy. It's basically exogenous hormone intake to reduce the risk of adenomas, colon or rectal cancer. It can reduce about 35%. However, there is also an increased risk of blood clot and stroke. There's also an increased risk of breast cancer associated with this kind of hormone use. So highly recommend and talk to your provider before starting this therapy. The last one is calcium and vitamin D intake. So vitamin D intake, 400 international units, and calcium intake of 1,000 for adults less than 50, or 1,200 mg per day for adults over 50 may help reduce colorectal cancer. However, overconsumption of calcium and vitamin D can lead to headache, hypercalcemia, GI distress like upset stomach or constipation. For the colon cancer screening, average age should start at age 45, which is the best age to start colon cancer screening. So all of this tests I'm going to discuss later slides. So the first one is colonoscopy, which is a golden standard for colon cancer screening and prevention. The doctor uses a long, thin, flexible light tube to check for polyps or cancer inside the rectum and the entire colon. During the test, the doctor can find and remove most polyps and some cancers. Colonoscopy also is used as a follow-up test if anything unusual is found during one of the other screening tests. This colonoscopy should repeat every 10 years. The second one is flexible sigmoidoscopy. Doctor put a short, thin, flexible light tube into your rectum, check for polyps or cancer inside the rectum or the lower third end of the colon. This test should repeat every 5 years or every 10 years with a fit testing every year. Last one is CT colonoscopy, also called virtual colonoscopy. It's use X-ray or computer to produce image of the entire colon, display on a computer screen for doctor to analysis. However, CT colonoscopy can only detect polyps. You still need the colonoscopy to remove the polyps. So this is some tests of stool testing. So a lot of them can be tested as a home testing kit. The first one is GFOBT. It uses chemical guanic to detect blood in the stool. It's a home testing kit from your healthcare provider, and it should repeat every year. You use a stick or brush to obtain a small amount of stool and return the test kit to the doctor or lab, where the stool sample can check for the presence of blood. Second one is the FIT test. You utilize antibody to detect blood in the stool and repeat every year. FIT test for hidden blood in the stool, which can be an early sign of cancer, but it only detects human blood from the lower intestines. Medicine and food do not interfere with the FIT test, so it turned to be more accurate and fewer false positive results than the GFOBT. And the last one is the FIT DNA test. It's a combination test. Combine the FIT test with an alternated DNA testing in the stool. For this test, collect an entire bowel movement and send it to the lab, where it can be checked for alternated DNA and for the presence of blood. The FIT DNA testing should be repeated every 3 years.
My name is Luke Brissette, and I'll be speaking today about prostate cancer. More specifically, I'll be speaking about the process involved with screening and early detection of prostate cancer, some of the risk factors involved with developing, and some strategies to reduce the risk of developing prostate cancer. This is an important topic to discuss because it affects so many men. In 2018, there were well over 1 million new diagnoses worldwide, with almost 250,000 in North America alone. It is predicted that 1 in 8 men will develop prostate cancer within their lifetime. More new cases are expected in the future, with North America incident rate expected to increase over 30% by the year 2040. These are some of the more commonly recognized risk factors for developing prostate cancer. Being an older man with specific germline mutations that can be screened for, or if you have a family member that was diagnosed with prostate cancer early in life. It's also known that people with African ancestries have an increased risk of prostate cancer. Symptoms that can be detected early on surround the urinary tract and include difficulty initiating or terminating flow and the increased frequency of urination. The prostate-specific antigen, or PSA, tests for a biomarker in the blood that is released by an enlarged prostate. It is recommended that men greater than 45 years old have the conversation with their doctor about the risks and benefits of monitoring PSA levels. The conversation should include the marginal mortality reduction associated with the screening, while being consulted on the perils of therapy. That could manifest as overdiagnosis and overtreatment, when unnecessary treatment can be more burdensome than the symptoms of prostate cancer. Men with elevated PSA levels but with no symptoms should use online risk calculators to help reduce the risk of ordering unnecessary biopsies, which are prone to complications. Also, men over 75 years old should discuss the risk and benefits of screening for PSAs in their later stage of life. Here are online risk calculators that serve as tools to help clinicians assess the patient's risk of prostate cancer. They will evaluate things such as family history, age, urinary tract function, race, PSA levels, and other patient-specific factors. In summary, speak with your doctor if you are over 45, if you are younger than 45 with a first-degree relative with prostate cancer, experience symptoms while urinating, or of African descent. And speak with your doctor about the benefits and risk of PSA monitoring for prostate cancer. Finally, I'd like to share how to avoid prostate cancer, and the best way to do that is to reduce your risk. The American Cancer Society recommends exercising for 150 to 300 minutes or 75 to 150 minutes of vigorous exercise each week. And of course, we want to exceed the upper limit if we can. Another important factor to consider to reduce the risk of prostate cancer is your diet. It's important to monitor what you eat as well as what you don't eat. You want to eat a balanced diet of fruits and vegetables with whole grains, and you want to avoid excessive sugars and processed foods.
Hi, my name is Jacqueline Penarrieta. I'm a PharmD candidate at the UConn School of Pharmacy, and I'm going to be talking about breast cancer. Breast cancer is the abnormal cell growth in the breast tissue. It can occur in one or both breasts. It can start from any part of the breast and can spread through the blood or the lymph system. Risk factors you can't change include being born female. Females are at a higher risk of developing breast cancer than men. Aging. Increased number of menstrual cycles, which include those who started their period younger than age 12, or who started their menopause at or after age 55. Exposure to diethylstilbestrol, a synthetic estrogen. Radiation treatment to the chest area during breast development, having benign breast conditions, having dense breast tissues, race and ethnicity. According to the American Cancer Society, white and African American women have an increased risk of developing breast cancer than Asian, Hispanic, and Native American women, and having a personal or family history. Factors related to your lifestyle include nullipartum, or never given birth, or giving your first birth after the age of 30, consuming alcohol, being overweight or obese after menopause, being physically inactive, using hormonal birth control methods, using hormonal menopause therapy, having breast implants, and smoking tobacco. Ways to lower your risk of developing breast cancer include getting to and/or staying at a healthy weight, eating a balanced diet, maintaining physical activity, avoiding or limiting alcohol consumption. If you're able to, consider breastfeeding for several months. Consider non-hormonal birth control and menopause therapy, genetic counseling, medications to lower risk, and preventive surgery, which these two are reserved for high-risk patients only, and close observation, which includes screenings. These screenings include mammograms and breast MRIs. It's important for a woman to know what their breasts normally look and feel like so they can report any changes to their healthcare provider right away. Signs and symptoms to look for would include a new lump or mass, which can be painless, hard, with irregular edges, or it could be soft, round, tender, and painful. Changes to the size or shape of breast. Changes to the skin appearance on the breast or nipple. Nipple retraction. Pain. Nipple discharge other than breast milk. And swollen lymph nodes under the arm or near the collarbone. Early detection. The American Cancer Society recommends for women of average risk to have the option to start screening every year for a mammogram at the age of 40. Women at age of 45 are recommended to get mammograms every year. And women 55 or older can have the option to switch to every other year or continue on yearly screenings. It's also recommended for yearly clinical breast exams to be performed by your healthcare provider, either during your physical or your annual exam with your gynecologist. And for you to do monthly breast self-exams. I've provided here a step-by-step on how to properly perform an at-home breast exam, so you're able to monitor for any changes, and you can report it to your doctor. Early detection is key for successful treatment. I hope you all learned something today, and if you have any questions or comments, please contact us. Thank you.